achieve his needs of having high GZ tolerance, high aerobic capacity, minimal fatigue, and keeping his blood glucose between like 120 and 170, there's a few things that he can do and that I will touch on in this video. GZ tolerance. So since he's diabetic, he has a higher blood sugar, which increases the reactive oxygen species and interferes with vasodilation and can cause vascular inflammation. And one way to increase his tolerance would be to resistance train. So he needs to endurance train and resistance train every other day, starting 3 months out. And for the resistance training, he should probably start like 20 minutes walking, biking, jogging, something endurance related, and then each week add on the minutes. And so he adds up to about like 60 minutes would be the ideal like amount of time for endurance training. And then for the resistance training, he's going to want to do a lot of reps and less weight, which will also help with his endurance of his muscles. And the endurance training is going to increase the number of type 1 fibers, and that'll help, and those are the more fatigue resistant. To have a high aerobic capacity, I would suggest that he does high intensity interval training on the days that he's like resistance training or even endurance training. And what that is like 30 seconds of intense like jumping or sprinting or something to get your heart rate up, and then 30 seconds of rest like walking or just stopping that exercise, and that'll increase his aerobic capacity. And that's because it increases the amount of oxygen used and helps the Krebs cycle work more efficiently, and that's like the most effective way to increase his aerobic capacity. Now, when talking about minimizing muscle fatigue, or just like fatigue in general, he's going to want to do a lot of endurance training. So like I said, the 20 to 60 minutes of cardio, and then also when he is weight training to use less weight and do more reps. And like I said before, that'll increase his type 1 fibers, which are fatigue resistant. Now, in order to control his blood glucose and make sure that it stays below 170, there's a few things that he can do. First, I would suggest that his crew have insulin shots in case it gets too high and he needs like a quick relief from that. But also the exercise is going to help, and then the diet is going to be really important. He needs to make sure that he's focusing on eating a lot of carbs and protein, more complex carbs, less sugar, obviously, and things like pasta, chicken, oatmeal, bread, eggs, those kinds of things are going to be really important. And he needs to stay hydrated, drink every day, obviously, the day of, to make sure that he's really pumping the water. And then, like I said, limit sugars like fructose. And then the day of the race, he should probably have something low in fat and fiber, and that helps with the gastric emptying. And then high protein and some carbs to help him maintain and sustain energy throughout his race.